We are living in a society where people are not aware of the basic concepts of gender and sexuality. What we require the most is support, both physical and mental. More than surgeries, what makes us happy, what makes us confident is the love and care from the people who care us the most. Hi, this is Dr. V.S. Priya from Thrissur, Kerala. I am currently a practicing doctor in Sitaram Ayurvedic Specialty Hospital here in Thrissur. Basically, I am a transsexual woman. I am here to talk about gender and sexuality, and most importantly, transgender health. I would apologize you all to excuse me for my voice because I am done with voice surgery last month. So now I am on voice training and voice rest. So kindly excuse me for that. And talking about transgenders, people are not aware of the basic knowledge regarding gender and sexuality. People are confused regarding gender and sexuality. When we talk about transgenders, people confuse that with homosexuality or bisexuality or something like that. See, gender is a totally different concept. Gender is what a person acknowledges himself or herself to express himself or herself to the outside world. And sexuality is something that connects to personal tastes. So I would introduce myself as a trans woman because I differ in my gender and my biological sex. I am a woman in my gender and I was born in a male body. And now I corrected my biological sex to match my gender, and now I am a transsexual woman. The society also. So we are on constant, mental stress. So what we require the most is support, both physical and mental. So if at all there is a person in your family who you identify as a transgender, the utmost thing, most priority that you can give is mental support. Support them, give them love and care, because that could change their lives, that could help them live as a normal individual. So, regarding myself, I hail from a middle class family, and I was fortunate enough that my family supported me starting from the stage of recognition. I recognized myself as a transgender and I discussed that first with my parents, and they gave me support since then, and they helped me to undergo my surgeries. They gave me the financial aid also for my surgeries. So this is definitely something to be considered among all families. If at all a kid discloses himself or herself as a transgender to the family, they consider that kid to be something against their family well-being in the society. Maybe that kid could bring a bad name to the status of the family. So mostly what happens nowadays is that either the family will discard the kid or the family will try to change the kid, and maybe they will take the kid to a pseudo psychologist and does something like conversion therapy to the kid. And that is, that is the greatest bad thing. So regarding the mental well-being of transgenders, it is very important. The first stage, the first step for transition is definitely uh, psychological assessment. We have to undergo the psychological assessment to make ourselves confirmed that we belong to the opposite gender. Being a transgender, it's very important to understand the total procedure of transition, because transition is definitely a serious procedure that we are doing against the normal physiology of our body, and it's not a silly thing. So we have to understand what all things we are doing to our body to make it match with our gender. First and foremost important thing that we should understand in this regard is in the spectrum of gender identity where we belong. That is the main important thing that we should understand in the very beginning. So we have to understand, we have to, acknowledge ourselves that we are a transgender. That is, our biological sex and our gender identity is a total mismatch. So, after identifying ourselves, or after identifying the position in the gender spectrum, the first thing in transition is psychological assessment that we have to do under strict medical supervision under a psychiatrist or a psychologist, medical psychologist. So we have to constantly interact with them for maybe 1 week, 2 week, 1 month, 6 months, or even 1 year to get the proper confirmation that we are a transgender and it's not just a fascination to cross dress. So we have to understand ourselves first, and then we have to start the hormone replacement therapies. And these hormone replacement therapies are also very important in the whole procedure of transition, because without that we can't move on or go on with the surgical proceedings. We have to at least do hormone therapies for 1 year for prior to the surgical proceedings, because we have to make ourselves confident both physically and mentally to welcome the changes that is happening within ourselves, within our body, and the changes that will occur to the society in accepting us as a transgender. The hormonal therapies should be underwent with strict medical supervision under an endocrinologist. We have to assess our blood and hormone levels at least once or twice in a month, and we have to correct the imbalances every now and then. And after this 1 year plan of hormone replacement therapy, we can then plan for the surgical therapies or the surgical proceedings. And surgeries are definitely a serious game, because surgeries are irreversible. Even the hormone therapies we can stop and go back to a previous position, but surgeries are definitely an irreversible procedure. So before surgeries we should think many times, do I require, seriously I require this? See, in the beginning I talked about the gender position in the gender spectrum. If we are belonging to the gender extremes, we can think about surgeries. But if you are falling in the midst of the gender spectrum, I don't think there is a need of surgical changes in our body, because most people will be comfortable within their body. It falls under, the percentage of gender dysphoria that one experiences. If a person experiences gender dysphoria, or if a person experiences extreme gender dysphoria, definitely we can think about surgical proceedings, or else hormone therapies or hormone treatments would be enough for a person to make himself or herself comfortable enough to survive. So, if a person take a strong decision to move on with surgeries, we should make ourselves confident. We should know what all things are going to be done in our body. So, before surgeries, we should have constant talks with our surgeon and with our doctors. So, we should be confident, and after that, in that status, we can move on with surgeries. And surgeries are also personal priorities. We can undergo innumerable surgeries, but such surgeries are all, physical challenges. Surgeries are all pain. We have to, think it seriously twice or thrice or whatever times. So, if a person have the determination to undergo whichever surgeries to make him or her confident level high, we can move on with that. Most people go on with two surgeries, especially when considering a trans woman. We undertake, top surgery and bottom surgery. Top surgery correspond to breast augmentation surgery, and bottom surgery suggests sex reassignment surgery or gender affirming surgery. So, gender affirming surgeries are more complicated. So, we have to have a proper idea before undergoing surgeries, gender affirming surgeries, because surgery is definitely a surgery. It involves all complications and risk factors. So, we should be in a position to face these challenges, to face these risks. So, this psychological counseling and psychological, affirmation is definitely involved in surgical proceedings. And one have to be, if at all one feels very low when facing surgeries or surgical challenges, we have to be in constant touch with our clinical psychologist or psychiatrist for that case. So we should be, if at all the family support the individual, if at all the family support, give at least a mental support to the trans kid or to the trans person. It is of immense value, because more than medicines, more than surgeries, what makes us happy, what makes us confident is the love and care from the people who care us the most, from the people who we consider that we want them till the last breath. So, psychological support and mental support from friends and family is very important. So, my final words would be to the people who are, living with transgenders, or the people who are willing to support transgenders or queer people. I would tell them, like, don't give special care or special considerations for them. Just treat them as who they are, as your friends, as your fellow beings, as your family members. Don't give them, more considerations, more care, that would make them feel like I'm something different, I'm someone different. See, being a trans person, I should feel like I'm a human being also. I'm living with, fellow beings who care for me, who love me, who support me. So I will tell you all to love your fellow beings, irrespective of gender or sexuality. Thank you.